Welcome, everybody, to Medical Myths, the show about what not to do with your body. And today we're talking about a subject that I wanted to talk about last week, but it's okay because you know what? Guess take a wild guess about who we're talking about today. Surprise! This is just now the RFK Jr. debunk show. Um, but we are talking about peptide therapy today. And this is a big kind of umbrella topic. But this is particularly in response to some news reporting about RFK Jr.'s activity and endorsements over the past month. And there are a lot of companies giving into this peptide trend. And there's some positives, there's some negatives, there's a lot of in between, there's a lot of ambiguity. So I wanted to take some time today to number one, discuss what the heck is going on with peptides. What are peptides? What are people using them for? Why are companies, both bodybuilding companies and medical practices, what are they doing selling these products? Are they safe? Are they regulated? All of that stuff. And what is the difference between the peptide products that are being pushed by influencers and RFK Jr. now, as opposed to what have been pushed by wellness influencers and MLM reps, because there are some definitions that are not quite in alignment. There's a lot of confusion because people may misunderstand what a peptide is and what specifically is being sold to them. So that is kind of the roadmap for today's particular show. So let's just get into this. All right, so this is an article from CNN back from the 15th of November, so a couple weeks ago now. But this headline says the trend of unproven peptides is spreading through influencers and RFK Jr. allies, which I'm not surprised by any of this. We know that RFK Jr. has a lot of opinions about medical care, and unfortunately is, driving the healthcare system in this country. So this is unsurprising for things that we've seen from him so far. This goes on to say more Americans are injecting themselves with unapproved chemicals that are pitched as ways to build muscle, rejuvenate skin, and extend life. In the latest example of the nation's fascination with alternative therapies and wellness hacks. Behind the trend is the surging popularity of GLP-1 weight loss medications. So they're talking about Ozempic, Wegovy, Zepbound, all of that kind of spurred on this trend of other peptide medications for a various array of purposes. And this isn't a new thing. So GLP-1 medications have kind of started taking on the scene when I was in medical school. So that these were medications that we were just starting to learn about when I was in my, second and third year of med school. But a lot of the peptides that are being marketed now, they're not necessarily new things. They have been studied more within the bodybuilding sphere, more talked about in that sense. But now they're getting more of a mainstream seat as Ozempic and Wegovy have really taken the market, not only for diabetes management, but for weight management in general. And I know the audience here can probably think of a few celebrities that have been using GLP-1 weight loss medications for cosmetic reasons as opposed to health-based weight loss. But we'll get into kind of what the differences are in these medications. But and something too with regard to the practices providing these therapies. I love GLP-1 medications. I love them. It's kind of with the new uh, structure of how healthcare is working in this country, a lot of these medications end up being kind of concierge based or telehealth based services where literally you can pay money, have a telehealth visit with a provider, and then get prescribed these medications. So for people who have good health insurance, or people who just have the money to pay out of pocket for these things, they can just get it. So that's something else we need to consider, looking at other alternative therapies, other wellness medications, because people can easily access this stuff. And are they being prescribed appropriately? And that is the next question. So it goes on to say, but the peptides being promoted by influencers, celebrities, and wellness gurus are different. Many have never been approved for human use, and much of their purported evidence comes from studies in rats and other animals. So we're talking in vitro studies. Several peptides, such as BPC 157, which I believe is body protection compound, and TB 500, are banned by international sports authorities as doping substances, and we will get into this. None of them are proven, said Dr. Eric Topol, a research methods expert and director of Scripps Research Translational Institute. None of them have gone through what would be considered adequate clinical trials, but nonetheless, many people are taking these. It's actually quite extraordinary. Those who've highlighted peptides' benefits include Health Secretary RFK Jr., who has built a national following among Americans who are deeply skeptical of health experts, pharmaceutical companies, and traditional medicine. For years, the FDA has been trying to crack down on the space, sending warning letters to clinics that promote the products and adding more than 24 peptides to a list of ingredients that should not be made by specialty pharmacies that often custom mix the formulations. That approach may be coming to an end. Kennedy has vowed to end FDA's war on peptides and other alternative treatments that are embraced by many in his Make America Healthy Again movement. Some of Kennedy's friends and associates are among the biggest proponents, including self-prescribed biohacker and longevity expert Gary Brecka, which we will go into his stuff. Traveling Lamp, welcome. Welcome to here. We're going to be doing a lot of discussion and some debunking today. But Gary Brecka, who sells peptide injectables, patches, and nasal sprays through his website for $350 to $600 each. In a May appearance on Brecka's podcast, Kennedy again promised to end the war at FDA on peptides, stem cells, psychedelics, and other fringe therapies. So we're going to get into the research on this, why there is such a battleground surrounding this particular issue. And there's a lot of nuance here. I'm going to grant it that. So am I opposed to Kennedy's approach to medicine in general? Yes, absolutely. Um, is there a lot of inappropriate prescribing happening with these medications? Yes. Is there any data to suggest that these are helpful and that they are safe? No, not really. Could there potentially be use for these in the future after we've had adequate study and approval? Yes. So today's stream isn't necessarily to say that these are problematic medications in general. This is not to say that these will never be useful. And that is not to say that they don't do the things that they are being shown to do. Very likely there will be good clinical uses for additional peptide injectable medications. However, kind of my stance on this, and you'll see why, is that we're not at a place yet where these are safe and appropriate to prescribe. So that is my perspective on this. A lot of times when we're talking about alternative therapies on my channel, a lot of times it's very hardcore. This is not an okay thing. We should not be marketing this. We should not be uh, or these things don't work, point blank, period. That's not where we're at here. There's just a lot that we don't know, and there's a lot of uh, poor regulatory practices with regard to these medications and where we're at right now in the process. But Brecka declined to be interviewed for this particular story. Peptides are now part of the circus of unproven wellness products. Peptides are essentially the building blocks of more complex proteins. We'll get into this more. I'm going to explain uh, what peptides are and all that. So I'll kind of skip that section. The FDA has approved a number of peptides as medications, including insulin for diabetics who don't naturally produce it, and human growth hormone for children with developmental disorders caused by low levels of the hormone. And yes, so to clarify, there are a lot of different hormones that we prescribe. And when we say peptides, we are talking about peptide hormones specifically. So there are a few different types of hormones. Kind of the two major ones we think of are peptide hormones and steroid hormones. And really, the only difference in those are the structure of the hormone and how they cause cell signaling. How do they exert their effects on the human body? So even though these medications that we're talking about today have a lot of overlap in the effects as anabolic steroids, we cannot say that they are anabolic steroids because they are not steroid hormones. They are peptide hormones. So that's kind of the big distinction. Otherwise, the effects of them are pretty similar. But we are talking about hormone therapy, and I do want to address something is that we see a lot of conflicting perspectives from the alternative medicine community and even in a lot of the anti-trans community with this idea that, oh, we don't want to be giving people artificial hormones. We don't want to mess up their hormone balance. But we do that constantly. A lot of medicine is managing your hormones. And I don't like the word hormone balance because the human body does not regulate on balance. It regulates on homeostasis. So in order to have reactions happen in the body, in order for any processes to happen at all, there has to be disequilibrium. Like we don't want equilibrium. Equilibrium is stasis. Reactions don't happen under equilibrium. So we want certain reactions, certain enzymatic activity to progress in a particular direction, which is not balance. But what we want is appropriate levels of different hormones for to maintain normal body function or appropriate body function. So we do prescribe insulin. We do prescribe thyroid hormones. We do prescribe growth hormones. We prescribe testosterone and estrogen. And those are specifically testosterone and estrogen are steroid hormones and not peptide hormones. But regardless, the idea that we prescribe peptides and we prescribe hormones, that is like it's just saying that we have a tool, right? Each medication is a tool for getting to a certain outcome. So I think it is problematic to say, oh, peptides are bad, or don't prescribe peptides, don't take peptides, or do take peptides. It's problematic to give a broad uh, umbrella response to something that it's like saying, yeah, use nails to build things, or don't use nails to build things. Don't use screws to build things. Right? That's just a tool that we have different purposes for. Sometimes it's appropriate to use a nail, sometimes it's appropriate to use a screw, sometimes it's appropriate to use neither of them. Um, so be careful of how we're using this language and what we specifically mean by peptides. And instead of saying don't use peptides, we should be saying be cautious about uh, having them prescribed appropriately. Be cautious about using unregulated peptides. Be cautious about very specific identities uh, of these products, what dosage they're in, what their mechanism of action is, what their contraindications are, what their side effect profile is. So, like, we really need to take this on an individual basis before we make broad generalizations about whole entire classes of medications. And they're going to get into here another issue, which is compounding. So, they say many other peptides promoted online have never been approved. We'll get into that piece as well, making them technically illegal to market as drugs. And yes, we will expand on that more as well. Under current FDA guidance, these peptides are also ineligible for compounding. So a compounding pharmacy, um, most pharmacies, they receive a very specific medication, and then they dispense very specific products with very specific formulations. They're not out there making their own mixes of different things to then market as drugs for specific people. There are appropriate times to use compounding. For example, if somebody has an allergy to a particular agent, like a stabilizer or something in the actual medication, then a compounding pharmacy could make a different formulation, removing that allergen, removing the thing that the person was allergic to. So there are some appropriate uses for compounding. However, the way that compounding pharmacies are regulated is can be a bit sketchy compared to regular pharmacies. And you have some compounding pharmacies getting away with selling illegal substances or unregulated products and then getting the money from it. And people who don't know any better and are giving into the wellness industry are the ones purchasing that and probably putting themselves at risk uh, for an improperly mixed medication. Like, they're gonna feel the side effects of that. They're going to be at risk for that. And, uh, it can like, it's not necessarily that they are always unsafe, they can be riskier. So, in that when people are trying to access some of these alternative therapies, they're not gonna be able to get them from a regular pharmacy that has certain regulations in place, but they can get them from a compounding pharmacy. So, removing those safeguards and allowing these compounding pharmacies to sell unregulated substances further promotes problems for people who aren't going to be able to get them from a more reputable source. So, we have a couple different ways that this can be further risking people's safety. This hasn't stopped celebrities and influencers from touting them. Of course, Joe Rogan here with his takes on this, and for the most part, anything that Joe Rogan and RFK Jr. are trying to sell you on is probably not well regulated and not well studied. I'm not going to say that everything that they say is incorrect, because a broken clock is right twice a day. But I wouldn't trust Joe Rogan as a credible health source. And now I also would not trust the CDC as a credible health source, as we kind of discussed last week. But he has repeatedly praised BPC 157, which is a peptide derived from acids found in the gut. And we will expand on that as well. But he claims that he had tendonitis in his elbow. He started using BPC 157 and it was gone in 2 weeks. So we have, some claims that this is going to work as far as sports medicine, and that is one of the industries more leaning into this now. He's among the celebrity clients listed on the website of Ways to Well, a Texas-based company that offers peptides, stem cells, vitamin infusions, and other alternative treatments. It's all a part of the circus of unproven, expensive, and possibly dangerous offerings promoted by wellness and longevity clinics, said Topol, who's written about the industry. For $99, Ways to Well offers a peptide consult with a physician, after which the company ships the peptide vials along with a full kit with dosing instructions and syringes, according to its website. So you pay 99 bucks, you get a consult, which how extensive this consult is, debatable. It could be that you have a very thorough evaluation of your medical history. It also could be that they just say, like, informed consent. Do you want this? Here you go. And especially with clinics that are willing to sell unregulated substances, I question to what extent they're actually performing their due diligence, or are they just trying to make a quick buck from high volumes of very, very rich people spending the money to do this. Peptides are often pitched as a natural alternative to modern medicine, and this is a uh, the naturalistic fallacy right here. So the idea that something is more natural, therefore it is better than modern medicine. And yes, peptides are natural. Peptides are found in literally anything that has proteins. Um, but this particular rhetoric that it is more natural is problematic. For example, arsenic is natural, snake venom is natural. Just because something is natural does not mean that it is going to be safe, right? So that's problematic in itself. Um, so before we kind of get more in depth into this, uh, I want to quickly get into what are we even talking about, because some of this language might be a little bit confusing. So a peptide is, I'm going to show this picture. So peptide is simply a group of amino acids bound together through peptide bonds. So when we're looking at this picture here, we have a chain of amino acids. So amino acids being the building block of proteins, right? And let's just look at if any of these individual sections, the dotted line separates out individual amino acids. So there are a few components of an amino acid. There's an amino group, which gives the name, which involves a nitrogen and two hydrogens, and those are bonded to a carbon. And off of the carbon, you have three different groups here. So this carbon is our kind of our C, or like our first carbon, our number one carbon. I will do a show, I think, on nomenclature of organic compounds because I do reference them a lot. But this is kind of our number one carbon. We have on this, we have the amino group. We have a carboxyl group, which is a carbon double with a double bond to an oxygen. And then the third group on there is called the R group. And you'll see we have R1, R2, R3, R4. And R is just a placeholder for whatever specific side chain makes that amino acid the acid that it is. So, for example, that would determine if it's leucine, if it's tyrosine, if it's glycine. All of those have a different R group, and that gives them different properties to help the protein fold where it needs to have certain effects. So, certain R groups will have atoms that attract water. Some of them will have atoms that repel water, and that they'll bind with other groups through hydrogen bonding to make certain structural active sites, etc. So that kind of the R group is really what gives the characteristics to that particular amino acid. But a peptide is just a strand, if you will, of bound amino acids all together. It's smaller than a protein. So protein is a lot more peptides bound together that have a particular function as a protein. But this here is a peptide with multiple different amino acids. And we have our N terminus, which is the side that has the free or the open amino group. So the amino group that's not attached to anything else. And then you have the C terminus, which has the carboxyl group, which is not attached to anything else. And so why we call these amino acids, of course, you have the amino group, and then this carboxyl group on the C terminus has a minus on it. So that means that in one form, that oxygen is bound to a hydrogen atom. And in this case, it is not bound to that. But when you have an OH group, that is considered to be an acid. So this form actually has an acid form and a base form. Um, but the amino acid essentially comes from this charged carboxyl group at the C terminus. So we have many, many peptide hormones in the body that have various functions. Like I mentioned, insulin is one of these. GLP is one of these. And yes, GLP is a peptide in your body that already exists, but GLP one is a receptor, and we have medications that bind to that receptor that simulate additional activity of GLP, providing improved insulin sensitivity, improved satiety, all that jazz. But when we're talking about these specific peptides, we're looking at ones that simulate growth hormone releasing hormone. And I'll get into that in a second when we expand more into what is uh, BPC 1157 or whatever it is. So let's get back to that article. Um, so they had the whole thing about natural remedies. Research claims are often employed to dodge regulators. So the research use language is pervasive across the peptide space, even in forms where users trade tips for buying, dosing, and stacking different drug combinations. So ideas about how uh, legal these are essentially. And I'll think I'll stop this article here because we're getting too far into the weeds on that. But now that I've kind of established what peptide hormones are, I do want to talk about specific differences between, different peptides and what exactly these ones are that people are using. And this kind of leads me into the MLM side of this. So this company started a while ago. Like this is older than this particular uh news headline, like way older than that. But this is Make Wellness. It is a multi-level marketing company. And they talk about peptide science. So this particular company claims the bioactive precision peptides are the future of wellness. And so they're talking about, uh, they say that there are 7,000 bioactive peptides present in the human body, 98% biological processes that require peptides, 50 plus peptide hormones that regulate metabolism and growth, and 60 plus muscles are governed by peptide signals. So, again, saying that like we're going to give you peptide replacement because peptides are normal in the body. We have lots of use for peptides, but then not being clear on what specific peptides we're working with, because again, it's like saying it's saying a whole category of things. Like, what are we talking about here? Are we talking about insulin? Are we talking about a random peptide chain from some steak protein that, like, if I ate a steak, I ate peptides? Like, are we talking about that? What specifically do we mean by peptides in this? And I think when we're too far into the weeds on jargony language, it hurts people who don't understand that. They're more likely to going to be scammed because somebody who doesn't know that there are different types of peptides and what we even mean by this. If somebody knew that a peptide was just a chain of amino acids that's found in proteins, uh, they might not be as impressed as when somebody is unaware and they see, oh yeah, bioactive peptides, that sounds awesome. And this is all within this biohacking trend nowadays where, people will sell supplements and sell different things with all these fancy words because it just sounds nice to them. Right. So this claims to unlock the potential of humanity. Peptides are the language of your body. They're responsible for regulating everything from muscle growth to mood to metabolism and recovery. But in today's world, those signals are drowned out. Citation needed. This is where bioactive precision peptides come in. So they claim to build muscle and recover faster, optimize metabolism, and curb cravings. Which, what do you mean by optimize metabolism? What specific mechanism are you trying to do with this? Are you claiming, like, I want to know specifically what they're claiming to do, because this is vague and unimpressive. Enhance cognitive function and clarity. Again, okay. How are you doing that? Support mood balance and resilience, promote hydration and cellular communication. So they have a lot of claims here. Yeah, and so they admit peptides are short chains of amino acids from natural sources like plants. Cool. Great. So you can literally just eat them. Like, you can get the benefits of peptides by eating appropriate nutrition, right? And so that's something that they are not mentioning necessarily here. They're saying that you need supplementation for these. Our bioactive precision peptides are extracted from ingredients like fava beans, ginkgo, and whey to provide pure bioavailable support without synthetic additives. You know what else you can do? You know what else you can do to get those same things? You can literally eat some fava beans. You can eat some whey. You can eat some cheese, eat some meat, drink some milk. Like, that's going to be a lot cheaper and more useful, because not only are you supplementing the peptides, but you're getting other nutrition as well. Like, we're getting vitamin C, vitamin D from your dairy sources. Fava beans, I do want to say, be careful with fava beans, because that is an allergic trigger for a lot of people, and not in our typical allergy IgE mediated mechanism. Um, but fava beans can be problematic for people with a mutation in uh, like their processing of free radicals. So uh, it's called a G6PD deficiency. So you have an enzyme called G6PD that is meant to help remove free radicals and prevent oxidation of compounds in your body. And most people have appropriate G6PD activity. And so antioxidant properties aren't as important for most people. However, people with a deficiency in the enzyme that processes those do need to be a lot more careful. And fava beans generate a lot of free radical activity. And if you are missing that particular enzyme, you can't appropriately process it. And so you could actually, uh, you could be hurt or even die from eating fava beans if you have G6PD deficiency. This is something that's often tested for, especially in the military. You're required to get genetic testing for G6PD deficiency. Um, but just a heads up, fava beans may not be safe for everybody. But how make uh this I know it's from Make Wellness, so they're saying make as a brand, but how make peptides work just sounds like really funny grammar to me. Uh so this is different from what I'm talking about with what RFK Jr. is promoting, right? So don't be confused here, even though they're using the same language to promote a vastly different product. So what is happening here is these, and I'm not saying that these are safe. I'm not saying that they're a good idea at all. But these are probably more benign than what RFK Jr. is shilling out. So let's go to their. Come on, let's go. I'm trying to click on it. Go to. Why is it not staying up? I'm just going to go back to that. Okay. So these are supplement powders that you can drink, or I think they have pill forms as well. But these are pill supplements. They're honestly like, how many are you getting with this? 'Cause you're paying for Fit, you're paying $130 for a 30-day supply of fava bean powder, which is insanity. And it's, of course, a proprietary metabolic matrix. So you have no idea how much of everything is in this. Uh, Let's see the ingredients. I don't think they show it. Oh, here we go. Yeah, the ingredients. So you're paying $130 for 30 servings of vitamin D, vitamin B6, vitamin B12, magnesium. They're a proprietary metabolic matrix that has an unspecified amount of each of these things, which Peptistrong Plus, which is basically fava bean powder. You have fava bean powder in this. You've got magnesium, nicotinamide, which is one of those B vitamins. You got pyridoxal 5 prime phosphate, which is another B vitamin, methylcobalamin, another believe it's another B vitamin, and cholecalciferol, which is vitamin D. Oh yeah, vitamin B12 is methylcobalamin. So you're paying $130 for 30 days of a multivitamin with some fava bean powder. You could literally just, again, I keep saying this, you could literally just eat some fava beans. But this is a lot more benign. Like I keep saying, you should not spend $130 on this. But what is Gary was his what's his name? Gary Brecka that RFK Jr. and Joe Rogan were endorsing. So this is The Ultimate Human, the website from Gary Brecka. It says science-backed habits that work. So he claims to be a biohacker. And if you go to his website, there's some things that he's promoting that are not terrible things, right? He's saying that sunlight is therapeutic. And yeah, sunlight is therapeutic. A lot of Americans, especially, have vitamin D deficiency. It's okay to go outside and sit outside. In fact, it's good for your health to do that. Like, unless you have some other condition where this is inappropriate for you, I recommend it. Go get 30 minutes of sunlight a day. Go on a walk. Go get some fresh air. Those things are great. Breath work. Go for it. If meditation and breath work are things that you need to help regulate your mood and your emotions, awesome, cool. Yeah, and breathing is great. You should be breathing. And then he gets into some weird stuff that are not scientifically backed, like grounding. This is BS. This is not demonstrated to be effective at all for anything. Cold water, which cold water comes from kind of the ancient Chinese practice, their view of medicine that cold versus hot need to be balanced out, and you don't want to mess with your temperature balance. We've learned kind of since then that your body does a really, really good job at regulating temperature unless you have some kind of issue in your thalamus and your hypothalamus. You're probably not going to impact your body temperature that much by doing a cold water plunge. If you want to do it, that's fine. Like, do it safely. Don't get hypothermia, but this isn't, it's kind of BS as far as, is it going to treat your issues? No, but go ahead and do it. I don't really care. So you go to this website and you think you're getting some pretty sound advice, right? But then you get more into this, like what exactly is he trying to sell us? And he's got here, I'm just going to try to zoom in a little bit. In addition to the peptides, which we're going to get into, he's selling the methylation gene test, which I've done a whole episode on that. He's selling hydrogen bath tablets, which I don't know. Liposomal NAD plus, liposomal glutathione, which these are all things that are in your body, and there's not really any evidence that supplementing them is effective at all. But that is not the focus of today's discussion. So let's look over at the perform and recover section. So we have here mentioned the peptide therapies, BPC 157 combined with NAD plus and this GHKCU patch. They have some other ones listed there, but we are going to primarily be talking about BPC 157 today. So, what is this? This is a powerful transdermal peptide patch. It combines three clinically researched compounds: BPC 157, NAD, and GHKCU, to deliver comprehensive support for healing, performance, and longevity. BPC 157 promotes tissue repair, reduces inflammation, and supports gut health. NAD plus supports mitochondrial function for increased energy, which NAD plus, just to clarify, that is a compound that carries hydrogen atoms to the electron transport chain from glycolysis and the citric acid cycle. So this is something that you naturally have. And yes, NAD plus is very, very, very important to have. And if you do not have enough of that, or if you consume it elsewhere in the pathway, you're going to run into problems and you will probably die. So NAD plus is important. The jury is out on, how effective is it to supplement NAD plus. The idea that in alternative medicine that, oh, you have something in your body that is a good thing and that is an essential thing, therefore you need more of it. I'm sorry, but you need data to support that. You can't just say, well, you have this thing and more of it is better. That is not good science, right? That is acting on intuition and saying, well, I just feel like more of this is okay. More of it could be problematic, right? Dose is important to consider. So don't give in to something just because it's natural and your body already makes it. Make sure that there's enough data to suggest that supplementing this thing is appropriate and that you're getting appropriate monitoring on this. But we'll get into why just having a healthcare provider monitoring it isn't even like the bare minimum of appropriateness anymore, because we're seeing some sketchy practices, um, specifically with the peptide industry. So when they say that they have three clinically researched compounds, BPC 157 is not adequately tested. And that is the most important thing in this. They are claiming that these are clinically researched, and yes, they are tested in vitro and they've shown some promise. And so again, if you missed out on the beginning of the show, my approach to this isn't to say that these are bad compounds, right? There is probably a really good application for using these. Just like how for a long time GLP-1s like Wegovy and Ozempic, like for a while, we weren't sure how those were going to do. Those were pretty new when I was in medical school, and we found that, we have very appropriate uses for them. We have people that are really being helped by these medications. So I'm not saying that these are bad. There's just not enough information yet to say that they are safe and effective. And what are they safe and effective for? And Boner making a great point. When you outprice proper healthcare and gatekeep education, grifters like RFK thrive on three-syllable word sales. And exactly. That is exactly the issue. This is an education issue and an access to healthcare issue. If we provided people with access to safe and affordable healthcare, we would not be in as much of a healthcare crisis as we're seeing today. Biohack like Gary, and he's going to push all of this other stuff. But what is BPC 157? BPC 157 is it's a growth hormone analog. And so there's a lot of concerns within the sports industry. We've seen these compounds being utilized a lot, prior to this particular thing, as an anabolic medication for bodybuilders. And so this compound is banned by most anti-doping organizations, and we can get into the nuances on problems with anti-doping regulation, etc. But that's where this particular thing is coming from. So to um, compare this to what we were talking about with the fava bean powder stuff. So when we say peptides, like, oh, peptide therapy, we may not be talking about the same thing. Because on the one hand, somebody's talking about, oh, I'm taking a vitamin supplement from this MLM company, and somebody else is talking about, I'm doping. I'm doping growth hormone, essentially. Uh, and those are very, very different things. So it's important that we use shared language and define our terms clearly when talking about this stuff. But here is BPC 157. So this is essentially, it is not growth hormone necessarily. It is something that this and the morellin compounds, the ipamorelin, premorelin, all that stuff are kind of similar in how they work. Not exactly the same, um, but they act on. I'm actually going to share this one in a second. I'm going to share a different one first. Um, let's see. I shared that one. Where did it go? I might have closed it. No, I didn't. Here we go. I found it. Share screen. Okay. So here is the mechanism of, I'm going to zoom in so y'all can see this a little bit better. Well, that's too far. Okay, that's as good as we're getting. So we have growth hormone naturally occurring in the body, right? Especially in times of puberty, you have a huge surge of growth hormone that causes you to get taller, get broader, all of that stuff. And you do have growth hormone that is active throughout your life, especially in places like your nose and your ears, which is why when old people seem to have different proportions in their face. That's why their noses are often bigger and their ears are often bigger, because those still respond to growth hormone even long after they're done developing. The uh, so the first hormone that is released. So if we get this time when we know we need to go through puberty and all that, the hypothalamus in the brain is going to release GHRH, which is growth hormone releasing hormone. That travels down to the anterior pituitary gland, which then stimulates the release of growth hormone. And growth hormone then goes to the liver and goes to muscle tissue, bone tissue, adipose tissue, etc. And both the liver and the somatic tissues produce IGF. And this is insulin like growth factor. So this causes essentially, it's called insulin like because it does reduce the amount of blood sugar. Because essentially, the job of IGF is to cause sugars, proteins, etc., to enter into the cells to be utilized so that the cells can increase their metabolism and the human being can grow. So you oftentimes can see, uh, reduced blood sugar. You see people eating a lot more because they're utilizing their blood sugar more rapidly. So that's a result of this IGF compound. And then IGF is released, and you get enough IGF that sends a negative feedback mechanism back to the hypothalamus that tells the brain to stop making GHRH. So once we stop producing the releasing hormone, then we stop producing growth hormone and we kind of enter into appropriate homeostasis. And so that's kind of how that feedback mechanism works. There's another hormone called somatostatin that is released by the pancreas primarily that also inhibits release of growth hormone. So we have a couple different inhibitory mechanisms in addition to this releasing mechanism. So BPC 157 and ipamorelin, etc., these peptide hormones, they are taking the place of GHRH, or some of them may be taking the place of IGF. So essentially, they are not growth hormone in themselves, but they stimulate the release of growth hormone and IGF. So, what is the issue here? So, we are messing with the feedback loop mechanism. So, your body naturally is either in a state where it wants to release growth hormone or it doesn't. And if it does, again, producing a lot of growth hormone causes then the inhibition of more growth hormone. But what happens? You have a certain amount of receptors in the hypothalamus that responds to, uh, you know, uh, IGF, right? And so, and all these hormones have a receptor that they act on, and it's a competitive inhibition mechanism. So what this means is you have a certain amount of growth hormone floating around, right? And you have a certain amount of somatostatin floating around. And if you have more growth hormone floating around, then you're going to get more activity as if growth hormone is there, right? Um, if you have, sorry, a growth hormone releasing hormone, if you have a lot of that floating around, the growth hormone receptors are going to be triggered. More growth hormone is going to be released, and you will get bigger. If you have more somatostatin molecules than you do growth hormone molecules, that somatostatin will bind to the growth hormone releasing hormone receptors and prevent GHRH from binding, therefore preventing further release of growth hormone. So when you add a supplemental, especially an injectable supplemental GHRH agonist, you are simulating having more GHRH than wanted at that time. So you're forcing the pituitary to make more growth hormone, even when it may have been inhibited before. And so this is some dysregulation of the pathway. And there are a lot of questions to be asked. There are questions in what is this going to do to the person's health if they do this? Some risks that we know about with increasing growth hormone. Again, you're going to be at risk for things like your ears and your nose growing, but that's probably a smaller risk than thinking about what happens if you have cancer and you add growth hormone. What is that going to do? Is that going to worsen your cancer? Is that going to cause cancer? Is it going to cause widespread muscle growth? Think about this. Your heart is a muscle, right? So if we're causing muscle growth beyond what is desirable for your body at that time, you could get cardiomegaly. And it's easy to think, more heart muscle, wouldn't that mean that you're going to get better cardiac output, better sports performance, especially in aerobic sports performance? No, not necessarily, because if you add more heart cells, your heart has only a certain amount of space to hold blood in it, right? And it needs to hold. There's a delicate balance between how much blood can the heart hold and how much pumping power can it have. If you infinitely increase the amount of muscle, you're reducing the amount of space within the heart ventricles. So sure, you can pump a lot harder, but you can't pump as much blood at the same time because you can't hold that much. And so that is a big danger that we just don't know how high the risk is of somebody getting that. We don't know, of course, what this would do to somebody in pregnancy. That would be really, really scary for someone to start using this in pregnancy. Um, and what is this going to do in combination with GLP-1 medications, thyroid hormone medications? What's it going to do to insulin? Like we're seeing, it's got IGF. It's going to stimulate IGF-1. So what you think of immediately is, okay, cool. This is going to uh, reduce my blood sugar. But over time, are you going to develop insulin resistance because you have all of this IGF floating around? Are you going to stop producing as much insulin? So, what happens if you stop taking these peptides? Are you going to need insulin at that point? There's a lot that we don't know yet, and that's why all of this is so scary. So, looking at the world of sports medicine, we have some emerging uses in sports medicine of peptide therapies, and especially with BPC 157. So, this is a paper from 2025. So, this is from this year, actually. And I believe this is just kind of a lit review, essentially finding, what studies have been done on this. What is the place of these medications within sports medicine? And we have some peptide, therapies that, maybe we can utilize. And we have ways that we can utilize hormones and utilize products from the human body to then uh stimulate healing, right? So they are trying to see if body protective compound 157, so this actually does come from gastric juices, so stomach acid, um and it functions to help improve the protective barrier within the stomach. Because, of course, you have a lot of acid in the stomach. You secrete this peptide along with your stomach acid to help promote your gastric cells to reproduce and also to maintain that protective barrier. So, utilizing this particular mechanism, can we take that and use it to promote healing of other cells? And when I say promote healing, I actually mean promote healing. We're not talking about a vague mechanism. We have some demonstrated angiogenic, anti inflammatory, and wound healing properties in vitro. Again, not really in vivo studies yet, but there is some promising research coming out. Um, and Hivesai asking, does the vertical stream get a lot of trolls? Yes. Yes, it does. Um, and I've just decided that I'm not going to respond to those trolls anymore. Um, but yeah, so the kind of the application for this is what Joe Rogan was actually talking about. However, again, he's talking about this from a place where these are not safe for human use yet. They have not been demonstrated to be safe for human use. But do they have potential? Yes. Yes, they do have some potential, and we could see these as treatment for arthritis, especially when we're talking about osteoarthritis, where you have cartilage degradation, especially in people's knees, in people's shoulders, etc. We could use this similarly to PRP, which is platelet-rich plasma. And if you've never heard of that, essentially you take out, you remove some blood. You're essentially blood doping a little bit, but not really. You're taking out a good bit of blood from the patient. You put it into a centrifuge. You spin it down so that all of the red blood cells kind of clump together, and you have the plasma left over. They take the plasma, they inject it into the joint, and it actually causes an inflammatory response. And so the goal with PRP injections is to cause inflammation so that the recovery mechanisms, they think that there is an injury. And I mean, there's a chronic injury, but now there's an acute injury. And so they try to get the acute injury healing mechanism to actually heal the joint and reduce pain. So uh, there's a lot of promise within, PRP, and PRP is actually being utilized, and it is a validated method uh, for therapy now. So it's possible that BPC 157 and these other peptides could be used in a similar manner for sports medicine. Um, However, a lot of athletes now are using this, are getting this from untrustworthy sources, and are doing so before this is validated to be safe. And yeah, and also a lot of organizations have banned it because of doping. And one of the other images that I had was a is actually from this particular paper, I believe. But this is the mechanism of BPC 157 and how it works in the body. So you have the effects on the blood vessels, which are on the left side. You have stimulation of enos, which is a nitrous oxide stimulating enzyme. And this NO is responsible for a lot of tissue healing within blood vessels. And then you also have VEGF, which is a kind of a growth factor for blood vessels. So you get angiogenesis, or no, NO does direct it vasodilates, and then you get angiogenesis. So you get more blood going to tissues, which increases oxygen usage and oxygen delivery. And then we have angiogenesis, which improves blood vessel formation. You grow new blood vessels so more blood can get to those areas. And so this could improve performance, athletically speaking, could also improve recovery because you're getting more delivery of recovery factors to those regions. You also have activity within acetylcholine receptors stabilization. So you get better protection of neurons. You get normalization of neurotransmitter signaling. You get tissue specific effects. You get signaling for angiogenesis within endothelium. You get increased fibroblast activity and collagen production, which collagen, of course, is responsible in wound healing. You get increased muscle mass. You get bone growth, bone development. So you get probably some reduced fractures. This could maybe have some implications in osteoporosis management. So there's a lot of potential here. We have mechanisms that suggest, this could be effective. But here's where this gets a bit dicey. So let's first look at this is an orthopedics and sports med clinic. And they kind of made a statement on their concerns with unapproved peptides. So they kind of say a lot of the things that we've said previously. Peptides are short chains of amino acids that can influence various body functions. Some have been studied for potential therapeutic benefits. However, many peptides circulating in the market are not approved by the US FDA for human use. This lack of approval, well, I mean, for now, RFK Jr. is trying to change that. He's trying to make them approved, which you can't just say that this is approved and then have it be safe, right? That is going to cause a lot of harm if you bypass genuine scientific processes and just say, I'm going to decide what is true and what isn't. This lack of approval means that they haven't been proven safe or effective through rigorous clinical trials. So we have here BPC 157, like we've been talking about, the purported benefits, including accelerated wound healing, reduced inflammation, improved joint and gut health. Potential risks and complications, like I kind of got into, unknown long-term effects, immune system reactions. It can trigger allergic reactions or autoimmune disease potentially in people. These haven't adequately been studied for safety in that regard. GI disturbances can cause nausea, diarrhea, or abdominal pain. Contamination risks. This is very big. Unregulated production increases chance of contamination with harmful substances and even infection risk. Like these are injectable medications, right? So we have any time that you are breaking the skin, you are increasing your risk of infection. Um, you have risk of injecting in straight into the bloodstream. These are likely intramuscular injections or subcutaneous injections, and not IV injections. But there is risk anytime that you break the skin. If you are injecting in an area with high blood supply, you could be at risk for getting this in your bloodstream. Um, yeah, and they say using BPC 157 is akin to playing Russian roulette with your health. The unknowns far outweigh the unproven benefits. Right. And so again, I want to mention that we're in a society that has been very vocal about opposing hormone therapies for trans people and opposing insulin for diabetics and opposing hormone therapies in general for people. Yet I don't understand. I mean, I do understand why. Legitimately, their argument is just transphobia. But how can you say that a uh, hormone therapy that has proven time and time again to be safe, is endorsed by every medical organization, has demonstrated positive outcomes far exceeding negative outcomes? How are we saying that that is dangerous? And oh, stop messing with people's hormones. Stop messing with people's puberty. When those same people giving those arguments are advocating for unregulated, compounded peptide hormones that are essentially doping. Like, that's okay somehow. Make it make sense. And they get into some of these other compounds as well. Ipamorelin, we did mention this one. Similar purported benefits. This one's more directed for muscle mass and weight loss. Metabolic disruption. So, yeah, altering growth hormone levels, like I mentioned, can affect metabolism, potentially leading to insulin resistance or diabetes. Can cardiovascular issues, possible risk of hypertension and heart disease, fatigue, injection site reactions. Yeah, we talked about that. Um, and we didn't talk a whole lot about these other ones, but there are a lot of different compounds out there for use. But you may be asking, but I got my peptides, or I'm getting my peptides, or I want to get my peptides from a doctor. Is that okay? Is that okay if I get it from a credentialed medical practitioner? No. No, and we're going to get into the legality of that and why this answer is still no. And the physicians, the PAs, the NPs prescribing these are taking a big, big legal risk in doing so. All right, so this is from a law firm that specifically works with healthcare practices. So this is from August of this year. The unregulated world of peptides, what you need to know before you inject. I'm going to zoom in a bit for you all. Peptides are the new buzzword in the world of fitness, anti-aging, and wellness. From promises of accelerated healing to enhanced athletic performance, Peptides like BPC-156 are being hailed as miracle molecules. But before you jump on the bandwagon, there's a crucial question you need to ask. Are they legal? And more importantly, are they safe? The answer, it turns out, is a lot more complicated than you might think. FDA status, not approved for human use. The first thing to understand is that the US FDA has not approved BPC-157 or most other peptides for any use in humans. The DoD's Operation Supplement Safety goes a step further, which I can expect that we're going to see something in the news about the DoD going back on Operation Supplement Safety and removing those minimal safeguards that we have for the supplement industry. Goes a step further, labeling BPC-157 an unapproved drug that cannot be legally prescribed or sold over the counter. So it is illegal to sell these, to prescribe these, to sell them over the counter. So can you get these from a doctor? You can, technically you can. Is it legal? No. And they, in doing so, they are breaking the law and they could probably lose their license for doing that. Why the hardline stance? The simple answer is lack of evidence. Most of the research on these substances is limited to cell and animal studies. There's a significant lack of human clinical data, and regulators have raised concerns about immunogenic reactions, peptide impurities, and poor product characterization. How are unapproved peptides being sold? If they aren't approved, how are so many people getting them? This is where users and even some providers venture into a legal and medical minefield, often relying on misunderstood loopholes. Non-FDA medications in wellness practices. In the wellness and anti-aging space, you'll often hear the term non-FDA medications used to describe peptides, NAD+, methylene blue, and similar products. The label is accurate in context, but it needs unpacking. Some peptides are FDA approved drugs, and that is true. Insulin is FDA approved. GLP-1 agonist, semaglutide, I cannot pronounce these generic names very well. Ozempic and Wegovy and certain growth hormone related peptides. These drugs are approved, manufactured under FDA oversight, and widely prescribed for specific medical conditions. Yeah, and so getting back into that, peptide again is a very, very big umbrella term. It's a tool. It's a whole class of hormone, a whole class of medications, and so we need to clearly define which ones we're talking about, their usages, their dosages, etc. Wellness peptides are different. The formulations marketed for anti-aging, tissue repair, or longevity optimization, such as BPC-157, thymosin beta-4, or CJC-1295 ipamorelin blends, are not FDA approved for any human indication. They're often made by compounding pharmacies, sometimes even by research labs, and sold into a marketplace where oversight is minimal. So yeah, they are not approved. The places selling them often have a disclaimer that they're not selling them for human use, they're selling them for research use. And yes, you can legally sell them for research purposes. However, you cannot sell them for use in clinical trials, like for human trials. They have not been approved for that yet. You can buy them to research on animal models. That is true. So you'll have people trying to utilize this loophole of like, well, we gave the disclaimer that these are for research only, but then still kind of communicate that people should be using them for their own wellness purposes. That's a loophole that they try to use. I would be curious to see how well that would hold up in court, because you cannot do that. That is not legal. Why providers call them non-FDA medications. And concierge practices being like the ultimate human thing, where you pay $99 for a consult and then they send you whatever medications you want. Basically, in integrated practices, clinicians sometimes use the shorthand to signal that these are not approved drugs, but are being offered anyway under a medical wellness framework. And so, again, this is something very important as well. Is that there is much tighter regulation to what can be sold as a medication and what can be sold for uh, treatment of a medical condition, as opposed to, well, this is just for wellness. So you can get away with selling a lot more things under this wellness framework. Like, oh, I'm not saying that you're going to treat any condition. I'm just saying that it makes you feel better. It made me, I don't know, improved my energy levels, things like that that are not really falsifiable, and are just vague and nebulous, which is why you no longer have, or at least very rarely have, these very blatant medical claims from wellness businesses, because they are trying to utilize kind of a vague language loophole to say, well, I didn't say it would cure anything. This isn't the same as off-label prescribing. It highlights that the products themselves lack any FDA approval. So they know it's not approved. They know that it is illegal to sell these, but they're getting around that, and they do not care. They do not care who they hurt. They just care about the money. The result is a confusing divide. Some peptides are legitimate, regulated drugs, while the peptides most discussed in fitness and anti-aging circles live in a legal gray area with no FDA approval, uncertain quality standards, and elevated risk for both prescribers and patients. The next loophole is an interesting one. Um, this one and the one after this one are like things that I learned a lot about. Um, the research chemical loophole and the crackdown on compounding. So, like we said, many of these are sold online as research chemicals. We already discussed that, with disclaimers like not for human consumption. Some physicians in regenerative and anti aging fields attempt to source them from compounding pharmacies. However, these uses fall outside the FDA approved pathways. The FDA warns that unapproved drugs lack assurances of safety, effectiveness, and quality. Federal authorities are taking notice. The DOJ prosecuted TaylorMade Compounding LLC for distributing unapproved peptides, including BPC 157, forcing the company to forfeit $1.79 million. The compounding maze, 503A versus 503B rules. So getting specifically into the law, the rules about compounding are strict and specific. 503A for traditional pharmacies, the FDA maintains a bulks list of active ingredients pharmacies may use. Substances with safety concerns are placed in Category 2. BPC 157 is in Category 2, with FDA citing immunogenicity and impurity risks. This means that 503A pharmacies cannot legally compound it for human use. So, what they're saying, they have there's a lot of substances, like if a pharmacy needs to compound a medication, such as for removing allergens, like for somebody with an allergy to a medication, they can essentially make their own version of this and then sell it. They have a certain list of ingredients that they're allowed to use for that purpose, and some that they are not. And so things in Category 2 are seen as unsafe, and so they cannot be used in those compounding products. I can't speak for a second. So that's for like regular pharmacies. 503B is for outsourcing pharmacies, and these are like what your usual like compounding pharmacies. Outsourcing facilities may compound from bulk substances only if one, the ingredient is on the FDA's 503B bulk list, or two, if the final product appears on the FDA's drug shortages list. BPC 157 is not FDA approved and therefore cannot meet either condition. We'll get it more into the drug shortages list in a second. So the next loophole that they get into is the drug shortage exception. So there are a lot of medications that if there's a shortage, then pharmacies can compound it, or pharmacies can use something else in place of that. So even if something is like has less approval, um, like if it's similar to something that is already approved, then you could kind of make this particular argument. Some confusion stems from a misunderstanding of the drug shortage exception. This applies only when an FDA approved drug is officially on the FDA shortage list. So that medication has to be on that list specifically. It does not apply to unapproved peptides like BPC 157 since there's no approved version to begin with. So if even if there's a drug shortage, if it's not an approved medication, that is not a legitimate excuse. A common misconception is this off-label usage, and that's probably the most common loophole that people are going to use with this. You may have heard the term off-label and wonders if it applies to peptides. Here's the key point. Off-label use is only for drugs that are already FDA approved for at least one condition. So unfortunately, like let's talk about ivermectin for a second. Ivermectin is approved by the FDA for parasitic infection control. However, it was being used off-label for COVID-19. Was it appropriate off-label use? No, not at all. It was not shown to be effective. There's no reason to be using it in that for that purpose. However, was it legal? Yes, technically, under off-label use, that would be an off-label medication because it already has FDA approval for one condition. But these peptides, BPC 157 and others, have never been approved, so there's no label to go off of. So, not a legitimate argument. Getting into compassionate use or right to try arguments. And this is something that probably appeals to a lot of the patient population. So, um, people who have terminal conditions or they have chronic illness that is giving them absolutely miserable quality of life, it is reasonable that they would want to try everything possible. Like they just want to, like they don't care if the science completely backs it up or not. They want to try. Like they want to see. Um and this does not fall under compassionate use or right to try for these reasons. You may have heard of pathways for patients with serious or life threatening conditions to access unapproved drugs. These are known as expanded access or compassionate use and the Right to Try Act. For expanded access, this requires the physician to get the manufacturer's agreement to supply the drug seeking IRB approval. So you have to get IRB approval, which is pretty difficult to do, and submit in an investigational new drug application to the FDA. So you have to submit for both of those things. Given the lack of safety data for most peptides, obtaining an IND will be very, very difficult. So you cannot use them for expanded access because the framework, the requirements needed to get expanded access through IRB approval and IND are not at all in progress. So no. So no, you cannot use this for expanded access. The Right to Try Act. This is for patients with immediately life-threatening conditions who have exhausted all other treatment options. The investigational drug must have completed a phase 1 clinical trial in order to qualify for that. And something too, so when we're talking about peptides, right, we're not talking about chemotherapy. We're not talking about like a breathing treatment, a new breathing treatment for ventilator patients, right? Like that's what we'd be talking about with Right to Try Act. The problem is this is not related to like cancer therapy, and in fact may be harmful for cancer patients. This is related to like this is a bodybuilding medication. Uh, it may be helpful for people with arthritis, but does arthritis treatment fall under this Right to Try Act? Like, is it appropriate to allow potentially long-term, uh, maybe even fatal complications from using an unapproved drug for something like osteoarthritis? No, absolutely not. Would it be more appropriate to do that for somebody with cancer? Yes. Uh, that's kind of the difference in this. Like using this argument to justify anabolic medications, nah. Sorry, dude. Joe Rogan, sorry, RFK. You're gonna miss out on your gains. I love seeing too with the conversations about these, reading the forums are like, are you still natty if you use these? I'm like, no, no. It's like very similar to if you were injecting yourself with growth hormone. Like you're just injecting growth hormone in a different way. You're just utilizing a different part of the pathway. You're forcing your own body to produce more growth hormone. So yeah, no, you are doping. You're doping if you're using this for that purpose. Um, Pathways like FDA's expanded access, compassionate use program, and the Right to Try Act are also not viable options. These are strictly reserved for patients with serious or life threatening conditions who have exhausted all approved therapies. They involve significant administrative hurdles and are not intended as a mechanism to provide unapproved peptides for wellness or anti aging purposes. The risks for professionals and consumers. At its core, the FDA Food, Drug, and Cosmetic Act is clear. No new drug may be introduced into interstate commerce without FDA approval. Physicians who prescribe or dispense unapproved drugs outside of authorized pathways expose themselves to serious risks, including civil malpractice suits, state medical board disciplinary action for unprofessional conduct. So you can report these people to the medical board. So whatever physicians are working with, uh, Gary, what's his face, we could uh, we could file a report against them for doing this. FDA enforcement and potential criminal charges. For consumers, the risks are just as significant. When you use an unapproved peptide, you have no guarantee of its identity, purity, potency, or safety. For physicians and medical providers, legally, a physician cannot introduce an unapproved new drug into interstate commerce. Prescribing or administering something like BPC 157 for regular patient care falls into this prohibited category. The common workarounds are not legitimate. It is not off label use. It is not legal to compound. The only legal ways a physician can provide a non FDA approved drug are through highly regulated programs, clinical trials, expanded access, and the Right to Try Act. Conclusion for providers. If any physician or clinic providing these unapproved peptides for wellness is operating outside of these established legal pathways, taking on significant professional, civil, and even criminal risks. The takeaway. The excitement around peptides often overlooks a critical reality. The vast majority marketed for wellness, recovery, and anti-aging are not FDA approved. This means every injection is a gamble on the product's identity, purity, and long-term safety. While the potential benefits may be appealing, the risks are concrete and significant, falling both on the users who inject them and the providers who distribute them outside of legal channels. And so, all of this being said, what is the takeaway for this medical myths stream? Well, we are staring down a very, very problematic avenue of regulation reform. We are staring down JFK, I'm saying this, RFK Jr. I cannot speak today. RFK Jr. trying to change the regulation, just bypassing the current FDA regulation and just saying, just like what he did with the CDC. The CDC's website changes were not made because of evidence. Literally, RFK Jr. came out and said he told them to change the website. And that is what I fear is going to happen with these peptides. He is clearly in favor of expanding access to peptides. So he I would not be surprised if in the next couple weeks we see him coming in and the FDA suddenly approves these. The safety data has not changed. The avenues with which people are getting these like have not changed. Like the safety for the prescriber, the safety for the patient are not changing. The only thing that changes is that the FDA allows these to keep being sold and allows them to go to the market without adequate regulation. Stating something is approved or stating that something is safe does not remove and should not remove your accountability if you are the one prescribing these. It should not remove accountability for RFK Jr. I think he should take full accountability for everybody that he hurts in allowing people to think that they're accessing safe, evidence-based healthcare when the only thing that happened is the website changed. And that is very, very scary for the health of people in this country. So, ending kind of on a heavier note, that's where we are going to leave off for today. Please, if you're hanging out here, I know I don't say this enough because I try to not be annoying, but please like and subscribe, like this video, subscribe to the channel. We are doing reporting every week, pretty much on RFK Jr. and on this healthcare system shit show in the US. It takes a lot of behind the scenes effort to get this information, to sift through the data, to find the sources, and to critically think through them. So please, if you like this content, I want to keep delivering it. Please, liking the video helps me a lot. Subscribe to the channel. If you're able to, you can become a member or a patron. That greatly helps me out as well. And join me for Holy Spirits later on this evening. Thanks again so much, everybody. And we will see you all next time. Take care.